Thank you so much for joining us here on the HIT Podcast. We went a little bit long on today's episode, so we will be breaking this over 2 weeks. This is going to be part one of what was such a fascinating conversation. I could not bring myself to bringing it to stop. So join us right now for part one of our conversation with John from Surest. Welcome to the HIT Podcast, HIT, Human Resources, Insurance, and Technology. I'm your very excited host, Toby Kennedy. If you can't hear my voice, I didn't even get through the intro without saying I'm over the moon about this episode, right? So my goal is to bring you guys digestible, well-curated, thoughtful conversations, things going on in the space of human resources, insurance, and technology. Try to keep my ear to the ground, try to keep away from shiny object syndrome and not go chasing everything. But every once in a while, when something is really cool, we bring it to the podcast. And every once in a while, something's really, really, really cool, I bring it to the podcast and I start sounding like this. This week's episode is brought to you by Montague Insurance Solutions. And without a pinch of further ado, let me please bring in a guest that I said before we heated up the cameras, like, this is potentially the most excited I've ever been about an episode. John, how are you, my friend?
I'm great. It's great to be with you, Toby.
I'm so excited. Okay, so people throw around the term game changer a lot, and a lot of times it isn't. But I will give the audience a quick background that obviously in my day job and my capacity as a consultant in the insurance space, we hear a lot about things going on. And we came across what you and I are going to talk about today. And I instantly I went home, I told my wife, I said, I've been doing this for almost 20 years. This might be the most innovative idea I've come across, and it might change things in ways that are so interesting that we get to live through and we're on the front end of. So John, if you don't mind, if I can just ask you, introduce yourself, a little bit about your background, kind of how you got into the chair you're in, and then just sort of take it away from me, my brother.
Sure. And I hope that I can match your excitement.
I've seen you present on this twice.
I have that passion inside of me too. And, it's a good way to tell my story. And I think that the story that I share is really something that's consistent with everybody that's at our organization. It's a very purpose-driven company. I was a kid who grew up with a mother that had multiple sclerosis, and it's a very difficult disease. I'd say kind of mysterious in a lot of ways, in terms of not only having a difficult time understanding what's causing the disease, but also having a very difficult time, especially years ago, finding treatments and solutions to help. You can't cure the disease, but maybe slow its progression, help ease some of the symptoms, etc. So I was that kid that was watching my mother, who I loved, suffer, and trying to find ways to help her. And so at a very early age, I kind of suffered from a very broken healthcare system, which then, even when we could find things that seemed like they could help my mother, then we suffered from an equally broken and hard to understand health insurance system and health plan that we were on. And so I just kind of grew up with, I think, that angst and passion, purpose inside of me to want to try to fix what I see to be a very big problem in our country and in our world, which is a healthcare system that's very difficult to navigate, and health plans that are often very hard to understand and utilize.
Yeah.
That's kind of where I come from, and I've spent most of my career working on the provider and the payer side, doing different things, basically utilizing technology to solve healthcare problems. And it's interesting, you talked about being very excited about this, and maybe not so excited, in the last 20 years. And an interesting fact about what we're going to talk about today is the same team that built this is the team that built a company 20 years ago called Definity, that were the pioneers of high deductible health plans, HSA, HRA account driven health plans. And I worked with that team 20 years ago. And you could argue that that was probably the last major innovation in terms of plan design
I would.
that's come into our industry.
I would absolutely argue that. Yeah. So what I do for a living is spreadsheet plans for employers, and we have an HMO, a PPO, and often an HSA, right, or an HRA, or another product that has its own column because it's so different. And you're right that the we now have a new column coming down the pike from the brainchild of the same folks that thought in the HSA space. And what I liked about the innovation of the HSA, because you're right, from a timing standpoint, that was something where you're like, hey, what can we do in healthcare? And I think the idea was put some consumer pressure on it, right? I mean, and if people are completely blind to the cost of it, the idea is something like LASIK, which is almost not covered by any insurance. That pricing has gone down year over year over year over year because consumers have said, hey, if I have to pay out of pocket for this thing, I'm going to find a provider that's equally as good, but that can do it for a little less money. Well, let's introduce that into the medical space. Well, the problem is when you look at, you go back to like Econ 101, you talk about elastic or inelastic expenses. Sometimes healthcare itself can be, not the right level of elasticity. So an employee, it's like, hey, at 11 o'clock at night, when my daughter's got a fever, I am not going to shop urgent cares to call around and say, hey, what are you going to charge me? What are you going to charge? What are you going to charge? What are you going to charge? I'm just going to go to one that's close, convenient, and I have it at my fingertips. So perhaps the consumerism we were hoping and dreaming for did come through in a way, but maybe not as pronounced. And so to kind of look at the data from that, look at 20 years of that experiment and say, I have another thought, and then come forth with something insanely innovative. It's why I leapt out of bed this morning to run into the studio.
Well, and I think it's interesting. If you look back 20 years ago, you probably remember the big buzzword back then. You said it was consumer-driven
Yeah.
healthcare, consumer-driven health. Yeah, that's all we were hearing about. And definitely this concept of account-based, HRA, HSA-based health plans was a novel concept, and it was designed to deliver on that idea. But it's pretty easy now to look back over 20 years and say it really did not deliver on that idea of driving consumerism. And for me, it's a simple reason. It's the lack of transparency that exists. And you talked about elasticity.
Mhm.
You know, it's interesting because it's unlike any other industry, any other vertical, any other sector of our economy
Yeah.
where you have the largest, sector of our economy that is shrouded with complete lack of transparency regarding cost and quality.
Yeah.
And I think that that's where the real challenge was for that concept, and
Yeah.
why 20 years later it didn't really live up to its promise and hope. And it's because how can you drive consumerism, if anything, if no one knows what anything costs?
Well, that's exactly right. That kind of opaque nature of this massive section of our economy now grapples with a technology coming a million miles along, including AI, who, not to get too far down that rabbit hole, but long story short, we have the ability to ingest much more data, digest that data, do something with that data, get something back, and legislatively, and this is sort of apolitical because it's gone through multiple different administrations, but legislatively, we've pushed for things like machine readable files and providers to really make a lot of data available that historically no one was really overly excited to let go. So we have this coming together of data being mandated to be put out, and put out machine readable files with technology that can ingest all that and do something with it. And so you get back together kind of the crew, and we wind up with Surest. And without kind of teasing the audience along much further, like, talk to me about where we're at. What is Surest? Give me kind of the high level for the audience, so we can dive into what this innovation is that we're all so jazzed up about for the last, whatever, 5-10 minutes of talk.
Yeah, I mean, I think to give you that, just think about it in terms of, so where are we today? We've had these different concepts like the high deductible plans that were designed to drive consumer driven health, and we really haven't seen that come to fruition the way that we would all want as people in this industry, or even as consumers, members of health plans ourselves. And so if you look at, so what is the problem that we're trying to solve? And I think we're looking at really two things. We talk about the two C words. We're talking about confusion, and we're talking around cost. And when you talk about that first problem of confusion, a major study was recently done that found that 1 in 4 people are foregoing medical care every year because of confusion about their health plan, confusion about costs, confusion around coverage. The average person doesn't understand concepts like deductibles and coinsurance, and all these kind of advanced concepts have been built into health plan designs that end up being complicated and ultimately confusing to the
Well, yeah,
members of those
because you're telling the
plans.
employee, hey, this is covered, but sometimes, but you owe this, but sometimes, but you owe that, but not until you pay this. And it's sort of
And
after you do this,
you owe
then,
20%, but you have no idea what the cost of anything is. So it's
and maybe it's
20%
not
of
even
what?
20% because it's 20% of the
Yeah.
billable amount, but the provider billed a different amount and yada, yada,
Yeah.
yada. I mean, I get why it's confusing. It is.
So you've got that C word,
Yep.
confusion, and then the bigger C word that probably everybody has been very fixated on, particularly over the last 3 years,
Yeah.
is cost. And study after study that's looked at the cost increases in healthcare, they've all come to the same conclusions. They've all pointed to the same kind of primary driver for these cost increases, and it's wasteful spending. It's waste. And it's estimated that in our country, between 25 to 30% of the annual healthcare spend every year is classified as waste. And you say, well, that's a big word. What is waste? And I think just for simple, understanding, look at waste as, if you looked at health claims, from the eyes of on the payer side of things, if you look at claims, waste would be things that you determine to be perhaps costs that were unnecessary, providers that are grossly overcharging for their services, providers that are over prescribing expensive procedures, drugs, treatments, imaging, lab work, et cetera, et cetera. Providers that have bad referral patterns, providers that are delivering poor outcomes. It's just seeing things like additional claims and additional services that were needed because of
Mm-hmm.
healthcare.
Yeah.
Um, so when you look at it from the perspective of, let's just identify all of these things that could be considered waste that are driving these cost increases, our whole goal was, how do we create a new health plan design that is built to help reduce that waste, that's
Yeah.
built to help finally achieve that goal of consumerism.
Right.
And
That's the other C that comes
now
in. We're going to talk cost and confusion. And you can kind of tackle those two with your other C, consumerism, if we do it right.
that's exactly right. And I think that we could all pretty easily argue that there wouldn't be so much waste, there wouldn't be all these unknowns, if there was more transparency.
Yeah. And
I mean,
and
wouldn't
that's
you
why I'm so
agree?
excited about where we are in this time frame, because we can have transparency in ways that maybe we could have earlier if we'd have set things up differently. But if grandma had wheels, she'd be a bicycle, sort of thing. So if you can change all those things. But where we are now, with again the combination of the mandated transparency and the technology to do something with it, we are seeing some cool innovation in the space. You guys top of the list. This
Yeah,
product is Surest
I
product.
feel like it really, I mean, you nailed it. It's an amazing time right now, because I feel like in a lot of ways, our whole mantra is, let's get our members of the plan the right care at the right time, at the right place, at the right cost. And it's interesting because I think as a company, as you're, talking about that, And I was thinking about the fact that as a company, as a solution, as a new health plan, I kind of feel like we are in the right place at the right time. I feel like there's a convergence of so many things happening. You have legislation that's finally happening, that's driving transparency and that's calling for equity and a lot of other things that really play well to what we believe in and what we built our plan to achieve. You also have all these things happening with technology. You have big data and the ability to analyze that data and do things with it like AI that we've never had the computing power and the know-how like we do today. And I think if you take all these things that are converging, we find ourselves at this really opportune and kind of amazing time where we can take advantage of all those things that are happening to truly do something that I don't like the term either, but that is a game changer, that
Yeah.
changes the way that we're doing things in a way that is such a fundamental and significant change that it can have a huge impact.
Yeah, I mean, we talked a
You
little
know?
bit about this. Last time we saw each other, we were at the Queen Mary in person together, talking about this product. And I said, if you don't mind, I'd really love to just get this in front of the audience. So to drill down a little bit, can you give me the nuts and bolts of why this isn't just an HMO or a PPO with lipstick on? Like, what makes this so different?
I think you just have to start with the fact that in a lot of ways, it's pretty simple. We didn't reinvent the wheel. I'd say we just took the wheel that existed and took a lot of the things that were on that wheel that didn't make sense or that were maybe affecting the performance of the way the wheel turns, and we got rid of them. So we just said, if we're going to deliver on the goals of simplicity, transparency, and then ultimately affordability, and go after those problems of confusion and cost, the first approach was to say, well, let's get rid of these complex concepts like coinsurance. Let's just get rid of it. Deductibles. Interestingly, the same team that created high deductible plans looked at this with fresh eyes and said, you know what? Let's get rid of deductibles. They're not serving a good purpose. They're serving as a barrier to care. They're serving as a financial barrier. They're not providing the benefits that they were probably designed for originally. So let's get rid of them. And basically, when you get rid of things like coinsurance and you get rid of deductibles, you get rid of the cost uncertainty that you have on these other plan designs, you're really left with a copay only plan. It's just a simple copay only plan. And the idea was, by going to a copay only plan, we get rid of the barriers of deductibles. We get rid of the confusion of coinsurance. You don't need a calculator to figure out what you're going to owe for your care. It's just right there up front as a copay,
Yeah.
so that the member knows exactly what their cost for care is going to be before they set foot in the clinic or the hospital. But then the real challenge, or I'd say the magic, and how then we ultimately built it out, was we said, okay, how do you, though, use those copays as a way to drive value-based healthcare consumerism?
Right. That's
And
the
the
real
answer
question.
there,
And I
yeah,
want folks to hone in on that. So, what we're talking about fundamentally is the design of a new health insurance program that you add to your portfolio. You've historically made yourself aware of what's an HMO, what's a PPO, and we talked about the high deductible plan. So, whether that's, you want to call it a CDHP, a consumer driven healthcare product, an HDHP, a high deductible health plan, an HSA, whatever, right? You've got these columns in there. The proposition that we're here to discuss today is add an option for employees inside of that benefits portfolio, and we're going to drill down further on it. But this plan design that we're adding will have no deductibles, it will have no coinsurance, and all of the member responsibilities will be a co-payment, something they can understand. You get X episode, you pay Y dollar amount. It is flat, fixed, straightforward, understandable. You see it right there. And I think the joke you made last time we were together, you're not going to get a bill in the mail 2 weeks later for the janitor who was at a network or something crazy that's just going to kind of take you by surprise. So I want people to drill in that that's where we are in the conversation. And that's what we've sort of established thus far. But you were just about to say, but there's some magic to it. There's something different to it. It's not just a copay plan. That's not why we all leapt out of bed today. There's some magic. That's all the time we have this week. We're breaking this episode over 2 episodes. Join us next week for part 2 of our conversation with John from Surest. That's all the time we have on this week's episode. We're going to keep to our time commitment. Thank you to our sponsor, TrueHue. Thank you guys for watching. Join us next week. Join us every week. And until next week, make this the best week yet.